my son, when he had his first major behavioral change, was like 8, and it was dramatic.
I had to pick up my toothbrush and put it down and pick it up and put it down, pick it up and put it down repeatedly.
Oh, wow.
Until the point where I was slamming it on the counter. Toothpaste was spraying all over the mirror. I was cursing profanities and I didn't know why. We don't need to bottle these emotions up and pretend like everything's okay. Meanwhile, we're exploding on the inside. That's not helping anybody.
The information shared on the Rethink It podcast is intended for educational and informational purposes only and should not be taken as medical advice. While Dr. Sande is a licensed medical provider, the content of this podcast is not a substitute for professional medical diagnosis, treatment, or advice specific to your individual health needs. Always consult with your healthcare provider before making any decisions related to your health or medical care.
Hey guys, welcome back to the Rethink It podcast. I'm so glad you guys are here with me, and today's episode is one that you're not going to want to miss. I say that every time, but I really mean it. This is an episode definitely near and dear to my heart, where we are going to be discussing the condition called PANDAS. It's PANS for PANDAS, Pediatric Autoimmune Neurologic Syndrome, or Pediatric Autoimmune Neurologic Disorder associated with strep. These are near and dear to my heart because we've experienced it in my home. So it is definitely an episode that I was excited to record, not just because I wanted to share this, because I know that there are plenty of other people besides me who have gone through this with their children, but also because, the perspective was from someone who had recovered from PANDAS and was thriving on the other side and had some really great wisdom to share with us. So today we're interviewing Ethan Pompeo, who has gone on to make a whole business out of his experience. It sounds familiar. We do that, don't we? When we get passionate about seeing something and we just can't shut up about it. That's what I do, and that's what he does. And he himself was diagnosed with PANDAS at a young age, or I think his diagnosis actually came later, but he had the classic experience of being bounced around. And he shares how that experience went, how he navigated that process and going through doctors and medications and all the things to land in a more natural way of recovering from this disorder. And as a result, he's very passionate about educating people about not just the disorder, and so that people feel less isolated and alone, but also to educate them about the power they have, that you have, the power that you have to change the health of your neurologic system with what you think might be small, but is powerful. Lifestyle, diet, nutrition, sunlight. These things are powerful. And we cover the spectrum today. So we cover the experience. We cover how he felt as a child going through it, what he saw his parents struggle through. I share a little bit about my experience, and without going too much detail, because I really want him to have the platform, but I did want to share a little bit of having the perspective of the parent, because he was the individual. So, and he ends up leaving us with a lot of great wisdom, and hopefully it will leave moms and dads who are dealing with children in this spectrum some hope. And hopefully if you're a child dealing with this, if you're a teenager or a young adult, and you just recognizing that this might be something you've been competing with or dealing with, that this will leave you with a little bit of hope. So this episode is one for you. Guys, I'm really excited you're here for it, and enjoy. Hey guys, I wanted to pop in, interrupt our podcast to encourage you guys and let you guys know, if you didn't know, our book is available. Stephen's story about his struggle through Lyme disease. Our book, Kids Get Lyme Disease Too, One Boy's Journey of Trusting God Through Lyme Disease. It is available on all areas that you can get books, everything from Amazon to Barnes & Noble to everywhere in between. All the places that you pick up books, you can pick up our book. So please support us and get the word out. If you have a child that's struggling, it doesn't have to be Lyme. I know so many children who just feel weird because their health is not doesn't match that of their peers, and they feel isolated, they feel unseen, frustrated, and alone. This book is meant to encourage those children. It's meant to encourage you parents that you can get through it. It's meant to make you feel seen and heard and give you hope. So please pick up our book. Thank you for so much for supporting our podcast and all the things that we do. You can see it's an ever emerging thing. I'm changing my studio. Today I'm wearing scrubs because this is the only time I've had to record, and I'm doing the best we can. And I appreciate that you guys are here with me at the root level, at the ground floor, as I'm trying to get information out to you guys that is valuable and hopefully life-changing, starting with the book. So pick up the book wherever you can pick up books, and thank you in advance for all your support. Well, welcome, Ethan. I'm so glad to have you on the Rethink It podcast. This is a subject that is near and dear to my heart, having had a child with PANDAS. So I am excited to have you on to share perspectives that I thought were incredible when we talked in the pre-show time, and to even just to talk about some of the extra tools that people might not know about that are available and that have a powerful impact on the brain when we're dealing with PANDAS. So we've got a lot to talk about today. So let's just dive in. Why don't you start by telling me a little bit tell the audience, you already told me, tell the audience a little bit about your experience. How did you come to the place where you got a panda on your website and you sell CBD?
Yeah, that's the long and short of it, right?
Right.
Yeah, so my journey began as a young adult, like many people with PANDAS. I was on the older end of the spectrum, however. I was about 13 years old when my symptoms began, but
Oh, wow.
if you're not familiar with PANDAS, it's not the cute, cuddly bamboo munching bear that we all know. It's actually a devastating disease
It
for
is.
the individual and for their families. And what happens is essentially you have uh, intense neurological symptoms ranging from OCD to motor tics, intrusive thoughts, compulsions, a very unusual behavior that disrupts your daily life and changes how you view the world.
Yeah.
And when I was 13, I went from relatively normal and healthy to all of a sudden having these tics and these intrusive thoughts almost overnight.
Did you, just a quick question on that, because some people remember that they got sick and then that happened, and some don't. Do you remember that you were like, I had strep throat or I got viral infection or I got some kind of something, and then a couple of weeks or months later, all of a sudden I have these weird symptoms? Did you remember any of that on your
No,
history?
I recall having strep repeatedly as a kid, but it wasn't until about 10 years later, really, that I even considered that that would have implications to a
Hmm.
neurological disorder.
Isn't that
So
crazy?
I don't remember a specific bout of strep that was
Pushed you over
associated
the
with my
edge.
symptoms,
Hmm.
unfortunately. I do know that my strep antibodies were off the charts once we started doing blood work for this. And the
Hmm.
relationship between strep and these neurological symptoms is PANDAS. It's an
Correct.
acronym for Pediatric Autoimmune Neurological Disorders Associated with Strep.
Hmm.
And basically, what that means is a strep throat infection causes an unusual antibody response.
Hmm.
Antibodies are one of the few compounds that can cross the blood-brain barrier.
Hmm.
So these eosinophils act as inflammatory compounds that enter your basal ganglia, the motor cortex of your brain,
Hmm.
and it causes all of these issues that we're talking about: loss of motor function, anxiety, OCD, all of these things which plagued me as a young adult.
Hmm. Hmm. Yeah. And there's actually, just for completeness sake, when we talk about pandas, that's the specific to the strep antigen. But there are other infections that can create antigen response like that, and that falls. So we often see you see the term like PANS/PANDAS together because they symptomatically seem this are exactly the same, but sometimes the source is the problem. So, for example, My son, when I tested him, he had both Lyme antigens and strep through the roof. And he had strep in the brain, still antibodies in the brain that were evident. So he would definitely be called a PANS panda kid, not just a PANDAS kid,
Right.
because there was another source. But there's other people who I work a lot with Lyme that just get a Lyme exposure and they get the same type of response. And it is devastating. So you were 13. My son, when he had his first major behavioral change, was like 8, and it was dramatic. So what was that like? What was your change, your behavioral change?
Well, here I was, entering adolescence really. It's a difficult age as it is. We're trying to figure out who we are and make
Oh
friends and
gosh.
enter new schools at that age. So there's already a lot of changes that we're dealing with. And then
Yeah.
compound that with a health crisis that comes out of nowhere. It was challenging.
Yeah.
And at first it was difficult to accept, to think, man, there's something wrong with me. Something wrong is going on. And I remember the moment we realized that, and I say we as my family, my dad came into the bathroom when I was brushing my teeth because I had to pick up my toothbrush and put it down and pick it up and put it down, pick it up and put it down
Oh
repeatedly
wow.
until the point where I was slamming it on the counter. Toothpaste was spraying all over the mirror.
Oh
I was
gosh.
cursing profanities and I didn't know why, and I couldn't control really any of my motor function, it
Oh
seemed.
wow.
And my dad said, "Dude, what's going on? Like, do we need to get you help?" And I kind of broke down in that moment and said, "Yeah, I think we do need to get help." And
Yeah. Oh
we
wow.
had no idea what was going on. Our first course of action was going to our pediatrician, who
Right.
said, "Yeah, this is beyond the scope of my care," and he referred us to a neurologist. And so, of course, naturally, my first time dealing with a specialist, I thought, great, we're going to go in there, get some answers,
Neurologists, they're the smartest
leave.
ones.
Yeah,
They
so it
work on the
did not
brain.
go as planned at all.
I
I
bet.
felt like we went in there, spoke to him for all of 5 minutes, and then left with a prescription for some blood pressure medication, which was known to have some off-label use for treating
Yep.
ticks.
Yeah.
So,
Had similar medication on
yeah, that
my
was my
son.
experience with modern medicine in a nutshell for the next decade or so,
Oh my goodness.
unfortunately.
So, and when we were talking, you said you kind of cycled through almost 40 different prescriptions. Is that right?
Yeah, just about over the next 10 years. So, yeah, by the time I was from 13 to about 17, 18, I'd tried about 40 different prescription meds, none of which did the trick, which is why we kept switching from one to the next to see what would work. Eventually, I hit a tipping point and I said, no more. I'm done with this. I'm done feeling like a zombie. I'm done dealing with side effects.
Oh yeah.
So we just decided we were going to take a different, more holistic route.
That's amazing. Now, what was how was that whole experience for your parents? I mean, I'm a little sensitive to that because I'm the mom of a child. And if I think back, probably had more neurologic effects on my other children too. But I have one child specifically who, I mean, just your story validated so much of my experience. But getting it from your perspective, where you've already processed through that experience and you're on the other side of it and you aren't embarrassed by it and you're on that other side of it. That was so validating and encouraging for me because though my son is healing from what we've been doing, he's still like not sure how to process the experience.
Mm.
Do you know what I mean? It was a decade like yours, a
Yeah,
decade of like, I don't know. Maybe it was just crazy or autistic. I'm just the autistic kid. That's what he used to say. I'm like, no, you're more than that. That's not true.
right.
But
Right.
yeah.
Yeah, it's a shame to put a label on yourself like that. And in a sense, that's what happened to me during that first trip to the neurologist. He diagnosed me with Tourette syndrome, which essentially gave us no answers, right? It was like a label. Okay, we know what it is, or so we thought. And it was more or less an excuse to prescribe me medication, right? We didn't know what caused it. We didn't know what the cure was. We didn't know
Hmm.
anything. It
Right.
wasn't until years later that we put the pieces together through talking with other more experienced specialists that we figured out this was related to a strep throat infection and inflammation and all the things we talked about with pandas. But with regards to my family life, I mean, so I'm a father. I have four daughters myself, all
Well,
very little, and
oh,
they're your world, right? And so to see suddenly your child struggling so mightily with something that's completely out of your control, especially as a father, that is, just crushes you, right? I mean, I remember my dad just so desperately trying to find answers and to work with me,
yeah.
but I was so closed off to the world about what I was dealing with. I was ashamed about my symptoms. I didn't want to admit that anything was wrong with me. I
Mm-hmm.
didn't want to talk about it at all.
Mm-hmm.
And part of
Oh
that
yeah.
was my
Oh yeah.
pride, right? But another
Sure.
part of that was a symptom of the illness. Just that obsession, the inability to get across what you're talking about,
It's like
shutting
you don't
yourself
have
off.
can't like find the words to describe emotions, and you don't want to feel emotions. And I mean, I remember my son said, I'm not going to let you make me feel anything
Mm.
because you're going to manipulate my emotions." I was like, what? Whoa, that's not a good symptom, and that is not a good thing to say. Like,
No.
what in the world? That is danger zone. Like, you don't want to feel anything. You know what am I supposed to do with that? That's
Mm.
terrifying. That was terrifying until I realized what it was.
Yeah, right. Absolutely. You're like, what is this kid dealing with? What's going through their head? And that was really tough for my parents, and honestly, I would get angry. I would get upset when they tried to pry or ask me about it, and they were out of the kindness of their heart trying to learn about what was going on, trying to get some insight from me on how they could interact with me or reduce triggers or stress in the household. And I just said, I dealt with it every second of every day at school, in my private life. The last thing I wanted to do is take that family time and talk about pandas and talk about my
Mhm.
ticks and all this stuff.
Right.
I did not want to talk about it. And a big part of my healing journey was moving beyond that and realizing that, it's okay to not be okay. Your life
Right.
doesn't have to resemble this perfect report card,
Right.
and in fact, in doing so, it might be an indicator of a larger problem. So, being able to accept what you're dealing with and say it's okay to talk about it, not only has it taken the weight off my
It's okay to
shoulders.
not be okay. That was a good statement. Yeah.
Yeah, I mean, really, and that's not just for pandas, that's for anything
That's
that
for
we're dealing
everything.
with,
Mm-hmm.
any kind of illness, depression,
Mm-hmm.
right, anxiety.
Mm-hmm.
Like, we don't need to bottle these emotions up and pretend like everything's okay. Meanwhile, we're exploding on the inside. That's not
Right.
helping anybody. It wasn't
Right.
helping me, and
Right.
it wasn't helping others around me who are, in fact, dealing with the same thing.
Right.
And part of disability is you feel isolated. You feel like there's no one in the world who can relate to you. No
Yeah.
one else is dealing with what you're dealing with. And
Right.
ever since I started being open about this and really embodying pandas as part of who I am, I've been connected with hundreds, maybe thousands of people who are in my same shoes and walking this journey and looking for answers. And we've created quite an amazing community, a resilient community of people who help each other. And quite honestly, the reason I'm doing this today is to offer hope and possibly solutions to those who are dealing with this illness today, because I am in such a better place. Like I said, I'm a father, I'm
Mm-hmm.
married, I'm running a business. Like,
Yeah.
I still deal with the
Way to
implications
go.
of this illness, but I have an
Sure.
amazing life, and that's what
Right.
I want to broadcast to everyone.
Amen. Yeah, we're not created to be in a mold. There's, I would say our struggles and our trials and our things that challenges that we have to overcome, whether it's an illness or abuse or anything else, that also creates in us something that we're able to give to the world. Does that make sense?
Mm.
Like we become something different than everybody else. So, and the world needs all of our experiences. In the world, we need to be compassionate. The fact that we struggle builds compassion in us naturally, right? And what is the one thing I think the whole world needs the most is just compassion and understanding, right? I was
Absolutely.
just curious, on that note, just before you got sick, what was your childhood like? Was it um, you're a normal kid hiking, playing soccer, or what were you kind of an introverted kid? Were you what kind of kid were you before you got
Well,
sick? And
yeah.
was the personality change like that dramatic, or was it just the ticks?
So Yeah, I was very active. My mom homeschooled us. I have two brothers and a sister, and I'm the oldest of all four. So I kind of led the way in that regard. I was the guinea pig, but my mom did a fantastic job homeschooling us. We weren't the stereotypical homeschool kids in the sense
Mm.
of being introverted and sheltered. We were very active in the community. So I played baseball. I was in Boy Scouts. We were at church 3 days a week. I played drums in a band. All
Hmm.
kinds of extracurriculars. Very
Boy, you sound
hands-on.
just like my son. He was
Yeah.
a drummer too.
How cool. And
Yeah,
to
that's
be
very cool.
honest, side note, drumming has been one of my escapes, if you will, one of my pathways to
Interesting.
healing. Not only because like just beating the tar out of the drums is a good release of anxiety, but
Yeah.
doing something that involves all four of my limbs and my concentration just completely
Calms you.
yeah, I mean, I have no tics when I'm playing drums. I'm just
Wow.
so involved and focused in what I'm doing. It's like there are no symptoms at all.
So
And
cool.
so one of the things I always recommend to people is like find those escapes, find those outlets that you
Yeah.
enjoy doing where you can go and step back and just take a deep breath and enjoy something for a little while
Right.
because
Right.
that'll make your whole day go by a little bit better.
100%. That's exactly right. That's so cool. So then when you had your like the big change with the tics was that the first symptom was more the OCD and tic stuff. Did you also have like a personality shift or
The personality shift came a little bit later, so uh, I'll say this: the first tick we ever noticed, and my dad and I talk about this sometimes when we reflect on the past. Like, we both remember the exact moment that my tics started, and we were at a theme park. We were on a family trip at Busch Gardens or some amusement park, and all of a sudden I had this skip step where I couldn't walk normally. I had to hop on one foot and double step on my right foot as I walked. It was very odd. And at
that was
first my
weird?
dad just brushed it off like, what's this
He's
guy
just being a
doing?
goof.
He's
Yeah.
being weird. Maybe
Hmm.
he's just excited. But that continued day after day, and more symptoms evolved from there. Um, I had this routine of having to pick up and put down any object over and over again until it was quote unquote just right.
Oh wow.
Right? It had to feel
Hmm.
just right. So sometimes I'd pick up my fork and put it down 15 times before I could eat. And
Oh
that
wow.
led me to a mindset of frustration
Mm.
and exasperation. And again, realizing that something's wrong with me. I can't control my body.
Right.
That started to break me down mentally. And further into my journey, I really struggled with not only anxiety, but anger and just loneliness. And it was really tough. And so, as many pandas people will say, I became very aggressive and violent, and I became very good at patching drywall because I put many holes in the walls of my bedroom through
Oh
throwing
wow.
things and just flailing my body around and losing control during these flare-ups, as we call. Flare-ups can be caused by a number of issues, but they're inflammation-driven, and when they happen, your symptoms can get very, very severe. And
Mm.
I'm talking about like an hour or multiple hours of just being seized up and having to do these ticks over and over again
Oh
with
gosh.
with no relief. So those moments are terrifying as a parent to hear your child just raging out of control for hours and there's nothing you can do about it. And as a patient, it's incredibly frustrating. I was
Oh my
completely
gosh. Yeah.
conscious and aware of what I was doing. I knew I couldn't control it, and
Ugh.
that'll drive anybody crazy.
Yeah. Yeah. Well. Yeah. Well, forcing somebody to do that would drive them crazy,
Yeah.
and doing it involuntarily is yeah, that's awful. That's awful. So at the point where you kind of were like, okay, done with medicine, I'm not doing this anymore. What was where did you go from there? And just kind of steps back. You were like, okay, I'm just gonna deal with myself, or what happened next?
Well,
Tell me the
I
rest
don't
of
want
the
to say
story.
anything that's
Go to
going to
chapter
get
two.
this. I don't want to say anything that's going to get this episode taken down or banned, but I had
Right.
found my own natural remedy, if you will, a green notorious plant that we're all aware of.
Yeah.
I was very, very involved in that culture, if you will, for a long time. It was the only thing I ever found that gave me some relief and an escape. And so I would smoke all day, every day in my teenage years, despite my parents busting me over and over and over again, and even having a couple of run-ins with the law.
Mm.
I continued down that path because, quite frankly, it was the only thing that gave me some relief.
How would
Not
you
to,
describe the relief that you got?
oh yeah, I mean, even my parents who are totally anti
Yeah,
that stuff,
very conservative.
they
Homeschooling, church three
yeah.
times a week. Yeah.
Right. I
Right.
mean, it's not something that they would ever advocate for.
Yeah, right.
So when they realized I was doing it, there was even more uh, clashing in the family. Right.
Sure.
There was just another level of
Stress
frustration.
and frustration, yeah.
Yeah, and so it continued to get worse. However, I remember one day I came home from school. My dad said, "Hey, have you been using?" And I said, like, why do you ask? And he said, well, because you're just really calm and relaxed. I'm like, Dad, you get it. This is why I'm doing this. Like,
Mm-hmm.
it mellowed me
Exactly.
out. It
Bullseye. Yeah.
exactly. And the
Yeah.
light bulb kind of went off in all of our minds and says, this makes sense. There might be something to this, in terms of why you're continuing to use this. And it wasn't just for fun. It wasn't just for recreation. Like, this
Right.
was something I viewed as medicine.
Mm-hmm.
Now, I'm not condoning this in any
Right.
way.
Right.
This plant has medicinal value, but using it in the way I was is not a medicinal use,
Right.
just to be clear.
Yeah, there was a podcast I recorded a while back, and it was based on the movie Medicating Normal, which is a really great movie. I highly recommend. Plug for watching that. But the lady I was interviewing was like, there's a physician in the UK wrote a book. Sorry, it's not present on the tip of my tongue, but she was advocating for the drug view of pharmaceuticals. In other words, drugs are drugs are drugs, right? Whether they have a label that they're approved for medical use
Yeah.
or not doesn't matter. They're still drugs. So the pharmaceutical drug is a drug. Do you know what I mean? Like
Yeah.
there is an impact on the body, as especially because this Medicaid Normal was about the psychiatric drug world. If they alter the brain and the way the brain works, doesn't matter what drug it is. It's a drug. You know what I mean? It doesn't matter if it's Ativan or
Yeah.
alcohol, right? So, yeah.
And quite
I
honestly,
just,
many of these pharmaceuticals mimic the illegal drugs in a capsulated form.
yeah, it's
So,
true.
and that was,
Hmm.
in a nutshell, my gateway drug was the pharmaceuticals that I was on for so long. It taught me that relying on a substance for relief was normal.
Yeah,
Doctors would recommend it. And if it
right.
helped you feel better, we were going to stick with it. If it didn't help you feel better, then we weren't going to use it. And
Hmm.
that kind of use model
Wow.
was normalized in my mind to the point where when I found this plant, I said, this is helping me. This is what I'm going to do. And I experimented with not only the legal form of these medications, but the illegal form as well in my just desperate search to find something that would help me feel better.
Right, right.
And so for many, many years, that was like my only outlet.
Option, outlet. Hmm.
Yeah.
Hmm.
So fast forward until after college, and I went through college cold turkey, like no meds, nothing, just kind of gritting through my symptoms. And it was
Wow.
it was tough. It was miserable. I mean, it took me 5 years to get my bachelor's degree, and my parents urging me not to drop out like every semester. But I finally did it, and I learned a lot, and it was great, and I'm glad I did it. But man,
Yeah.
it was a
Hard.
real challenge,
Hmm.
just on many levels, not just academically, but
Yeah.
socially and everything.
Right,
Learning
right,
how to
right.
live on my own with and battling this, and still
Hmm.
not really having answers.
Still isolated kind of
Very
feeling.
much so, and I have no
Hmm.
problem making friends. Don't get me wrong, but
Right,
friends on surface level where they
right,
see like what I'm doing, and we can even laugh and joke about my ticks if you're really close to me, but I
right.
still don't talk about it. I
Yeah,
still don't say what's going on. It's kind of just like something
yeah.
surface level that is going on, and I'm just the kid who twitches.
Right, right,
Um,
right.
so I talked about how being open and honest about what I'm dealing with was a big change, but
Mm-hmm.
shifting away from that mindset of substance use and substance reliance to lifestyle change and functional health was another huge key to my healing journey. And
Amen.
part of that was, well, first of all, like this plant I keep mentioning, it's
Mm-hmm.
very addicting, and people will tell
Mm-hmm.
you it's not, but it is. And it
It is.
was very, very tough for me to even recognize that it was not helping me as much as it should be. And so the side effects of that caught up with me too. You know, at a certain point my anxiety started to get worse when I would use it. I caught myself
Sure.
peering out the window for police at night, just
Yeah.
weird stuff.
Yeah. Yeah. Yeah.
Um,
Yeah.
and not to mention, you know, inhaling particulate matter in general is hazardous for your health.
It's
None of us
terrible.
should be
Yeah.
doing that.
Right.
So I needed to find a different solution. And
Right.
after college, I wanted to escape. I wanted to change of pace. So I moved to Colorado and got a job on the oldest organic farm in the state of Colorado. And I just fell in love with the lifestyle, working in the soil, working with people who were different than me, being outside all day,
Oh, it's
eating
so
fresh
good. I love.
produce.
It's
It
the
was a
reason I live
simple
here.
life.
Yeah.
What's that?
It's the reason I live here, man. It's so
Yeah.
great.
Oh, yeah. So I spent about a year out there in Greeley. And there's really nothing but farms out there. There's a university out there. But I just had such a great time, learned so much. And it was there that I was introduced to CBD, which is a non psychoactive form. Um, and essentially, it gave me all the relief that I had sought for many, many years without the side
Hmm.
effects, without having to be intoxicated, without having to
Hmm.
carry around something illegal, without having
Hmm.
to have
Be
the red eyes
paranoid.
or any of those
Hmm.
symptoms.
Hmm.
And I
Hmm.
realized that CBD, which is present in all forms of this plant, is nature's most powerful anti-inflammatory.
It is.
That's what I call it.
It
So,
is.
simply put, it would
Yeah.
reduce the inflammation in my brain, help
Hmm.
me to feel better, take a deep breath, refocus, and it was like an answered prayer in terms of giving me some relief that I needed to adjust, change my lifestyle, get away from that use model, start eating right, start exercising more, all of
Hmm.
these things that I
All the
advocate
things
for
that
now.
didn't happen when when we were medicinally treating ourselves with the other way,
Yeah, and
because
not to
it's part
mention the
not part of the
college
lifestyle.
lifestyle.
Oh yeah.
Right? Yeah, you're inside
Right.
all day, you're stressed about deadlines, like you're trying to impress your friends, this and that.
Oh
Like none
yeah.
of that is healthy.
Not sleeping well, you're
Mm.
eating processed food. Yeah, I love that you said that you're inside all day because the artificial light is a really major impact on the brain and the hormones and everything. Well, let's talk about the endocannabinoid system because it I love it. Let's nerd out on that for a minute because that's what
Cool.
we're addressing on, that level when we talk about using CBD in an anti-inflammatory way. It's supporting the endocannabinoid system. So let's talk about how and what that does. What does it do? How does where do you find the endocannabinoid? Where is that endocannabinoid system?
So the endocannabinoid system is dispersed throughout your entire body. It's actually the largest system in your body, despite the average person having literally no knowledge about it whatsoever. It's not taught in med school. It's very interesting. It was actually first discovered in the 60s by an Israeli researcher. And since then, just mainstream medicine has just refused to really look at it. There's very little
So interesting.
relatively little research about it. It is very interesting. But
I,
in a
when I
sense,
was in high school, I don't mean to interject, but
oh,
there was a
go.
friend of mine, he was an Israeli, and he enjoyed self-medicating
Yeah.
as well. And I remember he was really smart. We were in, I don't know, AP chemistry or something, and we had to write a paper, and he wrote it about that.
Yep.
He wrote about the benefits of, well, the other three-letter word besides CBD that starts with a
Yeah.
T, and
Yep.
how it
There's
affects
always
the
that
nervous
one
system.
guy, right?
Yeah. But he was basing it on that research, which I remember reading it going, wow, just like this is, I don't want to say how old I am, but this is a long time ago. So, but yeah, that just made me think of that. So anyway, go ahead and continue.
No, it's really cool. And the thing that people miss, I think, is the fact that this system was not put into our bodies as a means of like, for example, you know, I believe in the creator God. I don't think
Hmm.
the creator God would put this endocannabinoid system in our bodies knowing that we were going to go smoke plants. Like,
Right.
that doesn't really make any sense. And from an
Right.
evolutionary perspective, it doesn't make sense either.
Right.
So why is this system in our bodies,
Right.
right? What is the point here? Well, while many people will write a paper on the endocannabinoid system saying, here's what it does when you ingest these substances and it promotes homeostasis and all this, that is true. But innately, our bodies are intended to produce our own cannabinoids.
Correct.
So cannabinoids come from the plant, endocannabinoids come from our own bodies.
Inside. Hmm.
And when our bodies are receiving the right inputs, meaning the right food, a balance of light, social activity, all of these things we talk about, our bodies will create endocannabinoids in the right proportions to help us feel good, to give us balance. And as far as we are aware, the endocannabinoid system controls many functions of the body. It regulates happiness, mood, even body temperature. I mean, we've only scratched the surface on what this system does. It's connected to our gut. It's just fascinating. But the
It's
bottom,
it's it's what is stimulated when we go for a really good run and you get a runner's high, or that
yeah,
really relaxing feeling that you get after you've worked out real hard, and you come home and you're like,
yeah,
I just feel good.
that's the best.
That's because of the endocannabinoid system. Your endo and endogenous cannabinoids were released, your endorphins and these type of things, um, stimulating that across all organ systems, like you said. And I think it's fascinating that you say it affects every organ system. We're just barely touching the surface of it. When I started introducing it into our practice and into my family's life, my husband, who has kind of a propensity toward metabolic syndrome, even though he's very healthy, I mean, I'm an integrative practitioner. Like we have a sauna, we do all the things. We exercise, we work out, we eat organic, we eat Mediterranean, all the things. We do all the things right. Get the sun, go outside, all the things. He still has a tendency toward that metabolic syndrome, and he was kind of teetering. And one thing we noticed right away was just an instant kind of settling down of that glucose spike, because because I make him wear a CGM even though he's not diabetic, because we're integrative, right? But what was a dramatic improvement? It was one of those where he was like, look at this, look what happened.
Mm,
And wonder why that's happening. I'm like, I have no idea. I have no idea why that's happening. I hadn't read that in the literature. So I think
right.
it's fascinating, isn't it? Crazy.
That is. It's amazing. Yeah, and it's one of those things where the anecdotal evidence can speak for itself in some senses. Like, it works, you see that it can work by measuring quantitative data, and it's like, wow. I mean, they're saying that endocannabinoids from the mother's breast milk are present when the baby gets that milk high, as we say. Like, my baby will chug a
Ah,
bottle and just sit back. Ah, like
I'm so
that's
happy.
from the cannabinoids. Like,
Oh, that's so cool.
it's amazing. So, like, your baby's getting this in the correct proportions, and he's not
Yeah.
actually like intoxicated, but it's like
Yeah,
he
yeah, yeah,
has
yeah.
those good
Milk drunk.
feelings.
No, they're milk drunk though.
Exactly. But it's not so much milk drunk, it's more like milk buzz.
Milk
I don't
happy. Milk high. Milk high.
So I
Oh
just think
yeah.
it's so cool, and just the way that it's impacted me has been tremendous. Talking about CBD again, the reason that CBD helped me feel better and helped your husband is because our bodies were not producing the endocannabinoids as they should be. So essentially, like, if you're anemic, you can take an iron supplement or eat iron-rich foods, and it will help you feel better. It will cure that anemia. It will boost the iron in your blood. Same is true of taking CBD if you're endocannabinoid deficient, right? It's like supplementing your body, and that's exactly what I needed. My health was teetering. I was suffering from this inflammation, this encephalitis,
Mm-hmm.
inflammation of the brain that was causing all my
Chronic
symptoms.
low-grade encephalitis.
And
Mm-hmm.
so not only did CBD reduce that inflammation in a direct way, but it boosted boosted those cannabinoids in my body to help me feel better. So it was like a two-pronged approach from one supplement that's plant-based and natural and safe, and we've had it for 80 years. It's totally safe. Like, it was the ticket for me, and it gave me enough relief So like I said, I could take a deep breath, refocus. And when you're dealing with health crisis, I mentioned it's isolating, but you just feel stuck. Like you're
Yeah.
not getting anywhere, you don't have any answers, like no one
Yep.
understands you, or
Oh
at least
Lord,
if
yes.
you know,
Yeah.
and so sometimes you just need like a little push to get you past, get you unstuck, get you
Yeah.
over that hurdle so that you can start to
Mm-hmm.
make progress. And
Mm-hmm.
CBD was that for me. Uh, Ever since I started on that regimen and got away from the other lifestyle, everything has changed. I mean, I was underweight. I was 135 pounds, like skin and
Oh wow.
bones. I'm
Mm-hmm.
now 180,
Yeah.
185, so I've gained over 50 pounds of muscle mass. And I think on our pre-interview call, we talked about what the effect muscle mass has on eosinophils and inflammatory
Oh
compounds, and
yeah.
it's amazing. And
Oh
eating
yeah.
right and all these things have totally changed my life and changed my health.
Change your ability to, and I imagine the biggest impact is sort of that relational connectivity with people. I mean, if you're struggling, whether there's just that crazy feeling that you have that you don't want to engage too much with anybody on an intimate level, like get to know them really, 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 I'm at, or if it's just that you want to hide, there's both. Some people hide, some people just keep it surface, like you were saying. I bet the biggest impact has been the connectivity with other people.
Yeah, it certainly has a big impact. I mean, just being open and honest with others has taken the pressure off me. Just to say, it's not something that I have to continue to hide or bottle up. People would ask me, it was a daily ask, "Are you okay?" They'd see me ticking, twitching, picking up my pencil, putting it up and down. Again, I had another tick where I'd like hit myself in the head, and that was horrible. And
Oh
people would
gosh.
say, "Are you okay?" And it would drive me insane. I could feel like the warmth in my spine, in the back of my head. I was get so angry, and
Yeah.
they weren't asking me to be rude. They were asking me out of genuine concern, like, "Hey, are you
Yeah.
having a
Like,
seizure?" Like
do I
what's
need to
going
do
on?
something? What can I do? What can I do? I want to help. What can I do? Yeah.
Exactly. Unfortunately, there
Yeah.
was nothing they could do, but for me, I just wanted to be left alone. I didn't want to be that kid in the back of the class who's twitching. I just wanted to
Mhm.
be normal. Um, but that's not the card I was handed. And I do believe that life's challenges make us into who we are.
Right.
And we can't always control what happens to us, but we can
Hmm.
control how we react. And for many years, I did not realize that. I was just going through the motions, just trying to make it through each day. And when I realized that I could actually take control of my situation and view things differently, that's when I actually managed to reach out to others and start to
Mm.
help other people who were in my situation too, even by simply just talking about it. And so I've fostered so many incredible relationships through that. Coming up this
Right.
spring, we have a 5K fundraiser for PANDAS awareness
Mm.
with the Alex Manful Fund. And Susan Manful is a friend of mine and an incredible advocate for our community. And we're just trying to get
You're
as
in
many people out
Virginia.
there. This
You're
is
in Charlotte.
actually in D.C., in the
Oh,
nation's
okay.
capital,
Oh, wow.
Northern Virginia. So we
S-
do it every year. Really fun, great event, but just a wonderful opportunity to connect with people who are in that basket.
In
And they
that
all need
basket.
to
Yeah.
hear this.
Yeah, they do. They feel less isolated. And how have did you have any issues, when you're going through all that as a child? Did you have any like relational issues with your siblings? Was there an impact on those relationships?
Yeah, I
And
think
where
they
are you
were
now?
I mean, naturally, they were questioning things too. They wanted to know what was going on, and I think like I'm sure my parents had like family conferences minus me where they were like, "Hey, we need to be extra sensitive to Ethan today, blah blah." But we never really had that conversation until I was older, and
Mm.
even now, I don't think they fully grasp like the gravity of what was going on.
Right.
They had their own things they were dealing with,
Sure.
and the last thing I wanted to do was be like that problem
That
child or
one.
the one who takes all the attention away from,
Sure.
like,
Sure.
because I
Yeah.
was already being drugged around from appointment to appointment and getting
Right.
that special treatment in the form of trying to get me help.
Yeah. Yeah. Yeah, that's so frustrating.
Yeah, and
And
sometimes my tics would like involve them. Like my littlest brother, I would always pinch his cheeks, and he was very patient with me. But sometimes he'd get fed up. It's like stop,
mm-hmm.
and I'm
Oh
like
wow.
I couldn't stop, and he would think I was like
Trying to
just
be annoying.
yeah. And so we
Yeah.
had those arguments, and yeah, that was challenging for me. It hurt me because I knew it was bothering him, and but
Yeah.
I couldn't explain it to him. It was
Right.
really tough.
Yeah, not having the language. I think you just having the language. So you felt better, but at what point did you actually connect the dots okay, so you went to Greeley, you got exposed to CBD, you had it for the first time and you're realizing, oh, okay, this is helping me without all the negative side effects. Like take us from the journey of that to where now you r- put the pieces together that this was actually something called pandas. This is something
Yeah.
that was organic in my brain.
So I think it was during like the beginning of my college years when we put the pieces together and realized what was happening with pandas. But unfortunately, at that time, I had already kind of disbanded from any form of treatment. I had what I call physician fatigue. I was just sick of talking to doctors and this and that, and I just wanted to pretend like it wasn't happening, quite honestly. So even though we knew what was going on, the treatments were that were available to me were pretty invasive. Like we're looking at IVIG, where essentially they replace all of your blood, and you have to spend hours and hours in a hospital room. Like,
Yep.
no, I was not. That was
Yeah.
not happening. I was,
No.
it
No.
was like the last place I wanted to be on earth. I told my mom like I'd rather die. like I
Yeah,
just
yeah, yeah.
I was
No.
not at that point in my life, and that treatment has definitely helped some people. I mean, it's cured some people, but for me, the risks and the cost
That's
outweighed.
expensive. One dose is 5,000. Well, that was 20 years ago. It was one dose is 5,000. It's probably up to 10, but
Right.
it was one dose, and I think it's a series of several that you have to get. So yeah.
It's tough. And my
Mm-hmm.
parents would have been willing to pay for it, like
Mm-hmm.
just bless them. They were my advocates for they still are. And so I'm glad I had that option, but for me, I was like, look, I found this thing that's working for me. This is what I'm going to do. And my lifestyle revolved around that at that point. All my friends would partake and so forth, and part of that like brought a lot of negativity into my life. A lot of people who weren't so great friends that I was hanging out with, and just the severed
Yeah.
relationship with my family and people who cared about
Sure.
me, and
Yeah.
it was really challenging. So
Sure.
um, yeah, it wasn't until after college that I really realized, look, if I don't take my health into my own hands, like nobody's going to. I need to start changing some things up. And so that's when I started to really look at my lifestyle and how things could be different. And my wife was instrumental in that. We were dating long distance. She was living in DC working. I was in Colorado working, and she'd come visit me from time to time. She loved being on the farm, and she's just been very encouraging. She's been my advocate as well throughout the years. And in fact, she was the one who said, "Hey, you need to get a gym membership. Like, we need to start working out because you feel better when you're lifting those big crates of melons all day."
Mm-hmm.
And I
Yeah, that's
said,
good.
"No, I don't have time for that. Like, I don't want to do it." And she got my butt in there somehow, and now
She
it's part
nagged
of my
until it
routine,
happened. See,
right?
nagging is good.
In a good way. Like
Yeah,
the
no,
end
a
goal
loving.
was
Yeah,
beneficial, right? And so
right.
we have our gym dates, as we call them, where we work out
Nice.
together, and it's like, I go 3-4 days a week now. It's just part of my week that I look forward to. And after you do it for a while, like anything else, it becomes less painful. You're not as sore. You learn more about what to do, and how you can do it. It feels better. You get that runner's high. It's like
Oh yeah.
there's many benefits to it. So,
Yeah.
I don't know if I exactly answered your question, but that's kind of more or less what happened. I will mention my functional doctor here in Charlottesville. This was also after college. Once I moved back to Virginia from Colorado, my functional doctor here was instrumental in really like taking the next level of explaining like how all these things work in my body. And I think like gaining all this muscle mass and exercise was very critically important
Yeah.
because Dr. Abbott has said that muscle mass acts as a sink for eosinophils, which are like your white blood cells, those inflammatory compounds. And inflammation, it can be your friend. Like when you're faced with an infection, inflammation is your body's natural defense mechanism. But when it becomes chronic, when it becomes out of control, your body can start actually damaging itself,
Correct.
and that's what PANDAS is all about.
Hmm.
So by gaining like 50 pounds of muscle mass, not only was I diluting the effect of these eosinophils on my body, but they were actually like acting as storage mechanisms for them, because previously they had nowhere to go but cross my blood-brain barrier, right? And now they're in my body doing what they're supposed to be doing,
Yeah.
reducing, fighting off bacteria,
Right.
the role they're
Pathogens,
supposed to
mold,
play.
whatever. Yeah. Yeah. Well, what I'm hearing is that education about your experience, like education and lifestyle. So one of this, I really am highlighting that because I do this podcast for education. And when I work with clients, the biggest piece of our whole treatment together, our whole walking together through healing is the education piece, like knowing how your body works and knowing how to advocate for it and how to implement, like I call it strategic, like science-based lifestyle mechanism. It's really not that complicated, but our modern world has gone so far away from those modalities that it's like rocket science. Like I think the biggest thing that I struggle with is with people work with is this just the diet thing. Like we are just used to having it easy with diet,
Yeah.
like just easy food. If I have to work too hard for it, I'm not going to want to do it. Like, and just kind of teaching people to be, present and enjoy food is hard. Hard.
Yeah.
And then, you made so many great points about, being outside. I mean, like, I harp that point. I'm like, I know you're hearing it, but are you doing it? Like, go outside. I need 5 minutes. 5 minutes
Turn the
outside.
TV off, please.
Yeah. Yeah. And it when it's so far from what you're used to doing, it is like an active revolution. And it's like massive, it's like huge change, right? But when you start getting used to doing it, you're like, why would I do it any other way? you know?
Yeah. Yeah.
And the impact is exponential, right? It's not just like a little bit of help. I think that you made a really interesting point when you said that you needed a little bit of something to get you unstuck, that the getting your endocannabinoid system kind of stabilized was sort of getting you unstuck so that you could move forward with other things that are ultimately the ultimate healing came from changing your whole lifestyle, like
Yeah.
everything you've been doing, not just from magically taking one thing, because that's what medicine says.
Yeah.
Here's your magic pill.
Yeah.
You know?
Exactly.
Yeah.
And like, so with food, you're right. I mean, I have the viewpoint that the food we put in our bodies is our primary medicine. And it
100%.
should be. We shouldn't be eating, Chick-fil-A on the way home from work every day because it's convenient, and then having to take antacids or, whatever in order to feel better from the poison you just put in your bodies, right?
Correct.
If we went home and made a nice, like, grilled chicken with rice and some, kombucha or something
Yeah, right.
to boost your gut health and help with digestion and all that stuff. If you
Or
eat a healthy,
some
balanced meal,
fermented food on there.
yeah, like
You
it's
know?
really not hard and it's very enjoyable, and it's oftentimes cheaper than the processed junk you get at the store anyways.
100%.
It's a win-win. It just takes a little bit extra effort to get there, but you feel so much better.
It's this concept. I was saying this to somebody recently. I'm like, it's just about intentionality. Man, if you are going to school and you have a goal of finishing your degree because you're going to have this great job waiting for you, you are intentional about your homework, going to wherever internship that you're doing, just every piece you're intentional about. And food is the same thing. We call it mindful eating. I mean, like just creating intentionality about food, and not a have to, but I want to around it too, because I feel like a lot of times people are like, well, I have to eat healthy now. Like, but that's not how the Europeans eat. That's not how they eat in Rome, man. They eat some food. None of them are walking around obese. They're
Right.
enjoying their food. And there's this thing about enjoying your food that actually makes it more beneficial to you. So like that's all about the nervous system. Like if you're sitting there, I have to eat this thing because this is what my doctor says I have to eat, then the nervous system does something there, right? It's either setting up a fight or flight response, or it's kicking you out of parasympathetic or rest and digest. And you're over here just chomping away, doing your due diligence, eating your food, and your body isn't incorporating it because it's not enjoying it. There's literally an enzymatic response to that. And so I would push people to not just be intentional, choose well, food is thy medicine, right? But learn to love food
Yeah,
over,
be joyful in everything, really, right?
right? Right. Amen. That's so good.
Yeah.
That's
I
so
mean,
true.
truly, like, yeah, it's so key to everything we do, and I like to. So I have these three S's that I incorporate when I teach people about what I've been through and what I do. It's it's stop, start, and smile. So stop doing bad things in a nutshell. Start doing good things for your health, and then smile and enjoy the ride as much as you
Enjoy the,
can, because
mm-hmm.
everybody's battling something in life, whether it be
Uh,
illness or disability or uh, unfortunate situations, bad childhood,
sure.
stress, whatever it is.
Take it.
At
Yeah.
some point, if you haven't faced a challenge in life, you will. And
Mm-hmm.
so learning how to be happy through the good times and the bad times makes that journey a lot easier and more enjoyable when those
That's so
bad things
true.
happen. Preparing ourselves for that. I wish I knew that when I was younger, but
Yeah.
now I'm ready for the next thing that comes
Yeah.
my way.
Well, there's that's only something you can do if you don't feel like you need to have a total sense of control.
Mm.
Do you know what I mean? And so, like, if you're OCD, like, what you're trying to gain is control. So it's hard to stop, start, and smile
Mm.
when you're like, I can't even control this. Like,
That's a
I
great
want
point.
control. So I think that, in your situation, there was organic brain situation where like you wanted control for good reason, but a lot of us have this need to think we need to be in control, and that's also a facade, and we aren't, and so letting that go a little bit, like letting go of what you think is your control, will allow you to smile and breathe. you know
Yeah.
yeah.
Yeah, absolutely. Yeah, they teach that in many programs, like, in recovery programs, they emphasize the higher power because we have to realize at some point that we're powerless to control most of what happens to us in life. But again, you can't control what happens to you, but you can control how you respond to it. That's
Right.
something I teach my kids. And so, take what
So
life's
true.
given you, learn to see the good in it. And for
Right.
me, there was nothing good about being sick and
Right.
battling these symptoms, right? But
Right.
there is good in the fact that I've become so much stronger and more resilient through what I've been through.
Right.
I'm ready to face the next challenges of life. I'm ready to teach my kids what I've learned. And for everyone else, they say 1 in 200 kids has PANDAS now or tic symptoms.
Mm-hmm.
So I'm well equipped to help people who are in
Right.
my shoes, right? Who are grasping for answers, who are at the beginning of this journey. And so that's why I'm doing what I'm doing today.
Right. Exactly. Well, I think it's exactly it. I mean, I can tell you, having seen my child go through that, and his were a lot more, didn't have motor, but he had a lot more just emotional, just, it was just a spectrum of what we would call a mental health disorder.
Mm.
And so it's totally changed my view of what we just put a label of mental health disorders on, and go, well, what else is being missed here? I mean, I remember one day sitting outside eating lunch. This is like good 12, 13, or 10 or 11 years ago. And I was just starting to learn about holistic health. And I had just changed our diet, and I'd seen some changes in my kids' ADHD and things like those, and even in my health. And I remember having this sudden epiphany, like, what if, like, bipolar and schizophrenia is really not a happening like, what if it's food? Like, just I mean, it was an innocent, like, I'm sure people think that, like, duh now, but I don't know, maybe not. But I remember going, we have more control over this than what, because I was coming from a medical background. Like, medically, there is no hope for schizophrenia, bipolar, all these. They just need to be managed with medicine. Like,
Yeah.
and now I have a totally different view of that. I really don't see mental health as something that needs to be managed medically. I think that it can be reversed with the right help. And a lot of times in your, with children, yeah, PANDAS, it's up there on the list of something I'm looking for, especially with an inciting event. I mean, there's so much you can do to reverse that.
Yeah, you can change your lifestyle. You can retrain your brain to respond differently to these triggers and these stimuli that are driving you crazy. I mean, there's a lot of possibilities that don't involve relying on medication.
Right.
And I think a lot of it comes down to like treating our bodies the way they were intended to be treated from the very
Right.
beginning, right? We weren't intended to eat fast food and foods deep fried in oil or use a deodorant with
Mass-produced
aluminum on it,
vegetables. Yeah,
like
right.
all this stuff,
Yeah.
like the toxins in our food, the toxins in the air, the stuff that's in our clothing that we wear that our body absorbs. I just
Right.
learned that most tea bags have plastic in them, and it's getting
Mm-hmm.
into our like it's
Yeah.
just everywhere based
Yep.
on how our society has evolved. And like
Yep.
being conscious about that, educating yourself to how this all works and getting rid of those things, replacing them with good things. It's easier to smile when you're healthy, when you
Right.
feel good.
Sure.
So, yeah, I
Yeah.
think they all work together, and what you said is great. So, I appreciate meeting people like you who are working to do exactly that and truly trying to help people. That's what it's all about. We need more of that.
100%. We need more people to be aware, engaged, and supporting. Because I know there's plenty. I mean, the people that come see me are so tired of not having answers. They're you, and
Yeah.
I personally relate. So, and like I said, it's near and dear to my heart, and I'm so thankful that I came across you or you came across me, and we were able to get this podcast recorded because I know plenty of people who are eager to hear it. So,
Yeah.
so thanks for joining us today. If there's any like last pearl that you want to leave with our group, what would you leave us?
I think we've talked about a lot of good stuff. I mean, if the listeners would like to know more, like specifically about what I've done and my journey, that we mentioned all these different areas of healing. Well, I've written a blog post that goes into more detail about like what my diet
Oh, that's
looks
perfect.
like, some of the trainings I've done, including cognitive behavioral therapy and stuff like that. And that's available on my website. It's greenvalleynutrition.com, and you can find my blog on there. I've written some stuff specifically for PANDAS parents and again about my story.
Oh,
So
that's
feel
perfect.
free to check that out. And,
I'll
you
put the
know,
link in the show notes, so
yeah,
go ahead and check that out, and that'll be great. That's awesome.
yeah,
What a great
absolutely.
resource.
I don't have my own podcast this time, but I do a lot of these guest presentations. So, if this is something that people are interested in learning more about, I'm sure we could talk about doing another episode that focuses more on like the specific questions they have.
Sure.
I want to be available to help. I want to be a resource to people who are looking for these answers. So,
Yeah,
feel free to
absolutely.
reach out.
Yeah, sounds great. Awesome. Well, thanks again for coming on, Ethan. I appreciate your time.
Yeah, my pleasure.